Hello there. I have always believed in therapy and coaching. As a teenager, decades ago, I suffered from social phobia. And after a social rejection, I plunged into depression. What helped me was not the doctor I consulted, but therapy with a Christian psychologist working in a church setting that enabled me to recover my emotional balance. Later on, in medical school and thereafter, I was mentored by senior folks who guided me into a career that was satisfying and rewarding. The career I had chosen was one where I focused on therapy with individuals and families. From the start, I was guided by my mentors to work with those suffering from psychological trauma, particularly those suffering from the effects of childhood abuse, mainly physical and child sexual abuse. Being trauma informed, I'm sensitive to the presence of trauma and not infrequently asked to confirm it during therapy. This often occurs after about the sixth session or so, when a therapeutic relationship has been firmly established. So my impression is that roughly half of all my patients in therapy do in fact have a past experience of being in situations where psychological trauma had occurred. Apart from physical child abuse and child sexual abuse, some of these traumas were those that stem from emotional abuse from parental figures where my clients were very young. Emotional abuse is commonly verbal and can be behavioral as well, and refers to communication that control, isolate, and frighten the child. Examples of emotional abuse include rejecting the child verbally or behaviorally, and this can be deliberate or unconscious, ignoring or terrorizing the child, isolating the child from social context and interaction with others, peers especially. And if this occur in the context of a sexual abuse, the adult may corrupt and exploit the child. Besides childhood, psychological trauma can also be experienced by adults as a result of violence and bullying perpetrated by others, including those within family and romantic relationships. Disasters, accidents, political, social, and military actions to contribute as well to traumatic experiences. Helping those with trauma can be very challenging, and therefore it can also be very rewarding as well. Initially, I make use of clinical hypnosis. In the beginning, it was quite traumatic for me, as one of my very first few patients I have, while under hypnosis, acted out her traumatic avoidance and fears behaviorally. Later, I got myself trained and certified in EMDR. EMDR is eye movement desensitization and reprogramming, which is a very effective technique for the treatment of trauma. I also get trained and certified in EFT, which stands for Emotional Freedom Technique. Now, this is a tapping solution that also does the same and helps you to recover from your trauma. I also make use of ideas and techniques from Peter Levine's somatic experiencing, or SE, which calms and grounds the patient with trauma. In the process, I also make use of such techniques to help myself and allow myself to overcome my own personal trauma and experiences so that I can attain recovery from the various traumatic episodes in my life. In particular, I make extensive use of tapping, both EMDR and EFT, to help me overcome the anger, bitterness, and vengefulness that was in me. Currently, I use tapping and combine that with mindfulness in a meditative practice that has helped me to function at a higher level ever since. To fully recover from your psychological trauma and purge yourself from all the negativity, fears, intrusive thoughts, and recurring images from the past, you need to be grounded to the present and be calm enough so that recovery can take place. There's several techniques that can allow you to maintain calmness and remain in the present instead of focusing on the images, thoughts, and feelings from the past. After you're able to maintain your calmness, You next apply specific techniques to resolve the fears, thoughts, and feelings associated with the trauma. I do strongly recommend that you work with a specialist in trauma to initiate the healing process. Once a foundation is established, you can consolidate the gains by doing some of the techniques yourself in the comfort of your home, often with the continuing support and supervision of your therapist or the person who start you off on recovery from trauma. The benefits of recovery from trauma is huge. Once the fears, negativity, and entrenched thoughts and feelings disappear, you can install more positive and supporting thoughts and beliefs. Without the negativity, fears, and feelings and thoughts, you gain a sense of freedom. More than that, you develop a sense of purpose and meaning. Without the weight of post-traumatic symptoms weighing you down, you can now begin to live the best version of yourself, fulfilling what you most like to do with your life as you intended to. Hence, as a person who has overcome the effects of trauma, I'm reaching out to you. If you are also a victim of bullying, violence, and abuse, or from events like accidents or disasters in the past, I'm willing to walk with you, as I've done with countless patients, so that you can walk towards full recovery and healing, just as a lot of others have done. Reach out to me, see my Recover from Psychological Trauma video, and I will arrange to meet you online or on site so that we can work together for you to overcome your psychological trauma. Thank you very much for viewing this video, and I shall see you on the other side. Bye-bye.